Welcome. And in today's episode, we are actually at the Mwea, where we are doing a health talk and, of course, meeting the team that is here. We had a health visit from each Asia across the world, and we want to have more information. It's something under education or what they do. And before we start, this year the biggest mission is to make sure there's community empowerment. That really the biggest goal, not like to get a bigger audience, but just to make sure one soul is saved or one soul gets the information. So we are at home with the Maya, and we have the telling of the show. Going to introduce yourself, very soon.
Thank you very much, Ms. Caroline. My name is Dr. Edwin Kanyua. I'm the lead medical officer at MweaOasis, that is located in Wanguru, some place called Morika, second floor. We've been here for 9 months now. We have been welcomed here in this town and in the region of Mwea, and for today's session we hope that we're going to give us more information to shed light about the gaps that we found in medical services around Mwea, but also to tell you more about MweaOasis and what we offer. And we hope that this session will be very educative and you will learn a few things. Yes, thank you.
So, I tell you, when we reach the point, what are the gaps that you have seen that are here in the society that you want to put some light on today?
Well, being the month of January, because these awareness months are put there so that we remember conditions that are happening, many conditions that are affecting a big number of people. So January is cervical cancer awareness month, and we find that cervical cancer is by far the most prevalent cancer in females. So it's important that we talk a lot about cervical cancer. Cervical cancer is one of the most preventable cancers. Luckily, it's a preventable cancer whereby using screening methods that have been discovered, then it's possible to ascertain, or it's possible to prevent before cell changes of the cervix have changed into cancer. So unlike several other cancers, say lung or other cancers, then we find that cervical cancer, just like breast cancer, has a way in which you are able, through screening, you're able to detect early if changes in the cell are going to change to become cancerous or not. So it's important that every female, between the ages of 15 and let's say 50, is able to have done this cervical screening twice in their lifetimes. The ideal time is to have this cervical screening every 10 years, but they say by the time you're getting to 45, then you should have at least done this cervical screening twice. What happens is that an infection called HPV, which is sexually transmitted, so human papilloma virus, one of the strains, strain 16 and 18, goes to the cervix, infects it, and with time is able to change these cells from normal to abnormal. So using pap smear or other screening test, what we offer here is a pap smear, we are able to see if these changes of the cells are able to if the changes of this cervix, the cells, we take a sample from it. It's a very quick and procedure whereby we only do this in a matter of 10 minutes. We're able to get the sample, and then results are given to you within a week, and it helps from then. If the results are that there are no changes in these cervical cells, then we can say that confidently that for the next 10 years there will be no need for you to do that 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 test. Yeah. The sad thing is that these cancers are affecting even very young population, 20s, 30s. The other day, yes. Yes, 20s and 30s can also still have this cervical cancer, and the fact that it's preventable, then we would encourage or we would advise all female patients to come to the facility or to go to any other facility that is offering these services and have these PAPs well done. So to answer your question, I think it's important that, being the fact that this is January, it's cervical cancer awareness month. This is female cancers, and it's preventable. Then it's important for us to do that, to actually have that at the back of our minds. These are preventable cancers. So for those of ages, younger ages of the younger children, female children, then we are offering, we will then have a rollout whereby we can start giving them vaccinations. We are not there yet, but we would say that the most important thing for now is doing the screening, and that I felt that happened. This talk coincides with that, having this talk in January, and then that will be very important for all females to have their vaccine done.
I believe that's a clarion call for every woman reproductive age to have the screening done this January.
Yes.
And even in the year, you have a cervical screening done, and someone will ask, what should I do it? Or are there signs that I will see already that will warrant me now I need to get my cervical screening done? Yes.
Well, I wouldn't say really that there will be any signs, because if something is preventable through screening, because then after that, that's when we start to treat it early, we detect it early and try and treat it that early. So the ideal situation would be that everyone knows, everyone has had screening done, and they are able to do any cell changes in their cervix or not. So screening is where we are able to get this most of these symptoms, or most of these. That's where we are able to get these people who we are worried will go and have the cervical cancer. Of course, now if we're talking about symptoms and any changes in the spotting that wasn't supposed to be there, of course spotting any intermenstrual bleeding, then that should warrant the patient to actually come to hospital. Should not be afraid and should not wait for long before onset of symptoms and coming to hospital. So any patient, of course, who finds that they are spotting or they have any kind of bleeding that is not normal, that is between a period and a period when they are spotting, then it's important for them to come to hospital, because that is the most common symptom that the patients will have. Yeah, that does not mean that every person who is having intermenstrual bleeding definitely has cervical cancer. But then people who have cervical cancer are more likely to get that intermenstrual bleeding. So that is mostly the most common symptom that should bring patients to us.
So, don't ignore the spotting, don't ignore the changes of the cervical members.
Yes.
Have your cervix checked. Does it mean when I come and I told the cervix, like maybe there are so many things that be affecting the cervix, like recurrent infections, that I know when you invite your children to be here and all those things. So tell a message to a person who have been treating recurrent UTI and maybe you're not finishing their treatment, you just feel good and just get the treatment, because I'm sure they're there. They just put some light on it. They may need cervical cancer, fungal infection.
Okay. Yeah, that's urinary tract infections are a very common illness. So it's important that when you come to hospital, you do a urinalysis. That is basic. urinalysis for people with abnormal discharge. We have to do high vaginal swab. There's visualization of the cervix again and the whole vaginal canal, just to see if there are any abnormalities. But it's important that once this medication is given, then we finish the medication that has been given. Of course, for infections that are recurrent and have been hard to treat, whereby you're finding someone has been to multiple facilities and they're not getting better. Of course, we have a gynecologist on booking basis, whereby the patient can now come and have better and more focused treatment, so that their UTI problems can go away. Of course, UTIs and all vaginal infections are something that has psychological repercussions for patients, because they are feeling uneasy, either describing that to someone or even to the doctor, or then day-to-day life becomes a bit uneasy. And so it's important for them to know that we are here and we understand that urinary tract infections is something that happens a lot, and it's important for them to come before complications happen.
All right. So there is a team here that will also ask me, when boy child tumeachwa. Boy child, unasema wasichana their cervical screening done in January. So what about the screening of boy child?
Well, when we come to cancers of the male, you find that most of these cancers happen preventable, because that's where they happen later in life. Say prostate cancer, it's not very common to find it happening in early years. But then it's important that you do wellness checks. When you say wellness checks, we mean that when you come to the facility, we're able to do a full hemogram for you. We have a very good lab there. We're able to do a full hemogram for you, just a whole complete body checkup. From the doctor doing a consultation, listening to your heart, listening to your lungs, checking your throat for any other sign that will be or symptoms that will say there's an infection, or there's a big, what we call a big disease happening. So screening and just general wellness checks are available here. So it's the fact that now for females, the breast and the cervical cancer are preventable, such that it's possible for you to see them before the changes have happened. Yes.
So virtual screening is still ongoing in the facility, and I'm sorry for the background noise. It means that Equity Apia is allocated at the prime of Mwea, just along the road, the Nairobi highway. The new Eastmark building, the new Eastmark building, they're just located there. So you can give us more information about Equity. So when we hear about Equity Apia, because the first thing that stands out is the bank, Equity Bank. And we think money, like Zima facility is very expensive. Like, tell us what stands out to Equity Apia, and is it a place, a working place for a mwananchi wa kawaida?
So we are located along the Nairobi Embu Highway, America, next to the new Eastmart, second floor. The thing that stands out for Equity Apia would be the fact that our prices are very favorable. Before we've gone to prices, the fact that we have over 140, maybe 145 facilities now, both in Kenya and a few in DRC. Yes, and a few in DRC, maybe 5-6 in DRC. So that would mean that your health records, if you went, for example, to Kutus, or went to Kenol, or went to Nairobi, or went to Siaya, or went to Kwale, then your health records are still as they are as when you left them in Equity Apia of Mwea. So a doctor in or a nurse in CI is able to see your health records and your details. There's continuity care. The dawas you're using, what you were given last time, so it doesn't matter if you're traveling or not. So I think that is a very important fact. And then the other one is that standard of care, such that the what you expect you're getting here is the same thing you expect to get in that other facility. Of course, with the affiliation of the bank, Equity Bank, which is our partner in one way or the other. We are under the Equity Group Foundation. So Equity Afia is the health pillar of the Equity Group Foundation. So they ensure that the standards at which they are placing things is top. So we offer quality, customer service is good. The labs, the lab work, the type of machines that have been purchased, the attendants that are attending to the clients or to the patients are professional and know what they are doing. So the same standard that the bank would have is what is extended up to the Equity Afia clinics. So when you're coming to Equity Afia, you're sure about the standards are good. You're sure that the clients are the people who are treating you are professional, the people who are treating you are kind. The kind of feedback that you give is goes direct to the people who are concerned with the Equity Afia. So the fact that it's a big franchise, and we know that the kind of feedback you're giving is important, and action is put immediately after you've given that. So well, I would say the standard is very high. The level of care and the kind of like what we are saying, the dawas that we get, the pharmacy, we don't even buy dawas locally. We get them from a central procurement, which is provided again by the Equity Group Foundation. So it's a very good model, and we have seen that work. The kind of people who are employed here have to pass through that rigorous exercise before they have been posted here. So standard prices are favorable. We think about, by the time prices are being set, we think about standardization of all the patients who are walking into Equity Afia. So we wish or would advise or would call for all people to feel free to come and see how Equity Afia is doing.
All right. So what services do you offer?
So we have a doctor's consultation. We have pharmacy, so we can a patient can just come and say, I want so and so drug. We have a lab. Lab has full hemogram. We have urinalysis. We have random blood sugars. We have biochemistry. Your HbA1c for people who are diabetics. UECs for your kidney functions, liver function tests, thyroid function tests. We have HIV. We have syphilis. We have all hepatitis. We also, so that is part of the lab. We also have imaging, which we do ultrasound, so pelvic ultrasound, obstetric ultrasound for our mothers. We have antenatal clinic for pregnant mothers. We have MCH for vaccination of children, and then we have specialists. So we have nutritionists, we have dentists, we have optical, we have gynecologists. Yes, so that those are just some of the services we offer. So we are outpatient facility that offers a wholesome approach to the patients. Yes.
So they're doing community empowerment. That's the last way So when you're doing community empowerment, and you meet a phone call who just got an A, very really fast, and they say, I'm going to be a doctor. Tell me that one thing that is so personal to you that you tell them, we can transfer this one. Not just the money and the good grades, but there's one thing that you you personally love about your dogs?
I think that's a tough question, but why this is a good, it's because one, you meet everyone, you meet everyone comes to hospital, from everyone, everyone comes to hospital, a child, an old person, a driver, like every person will at some point in their lives come to hospital. That's a very humbling experience to just be able to interact with these people and have an answer for all these people. So if you love, caring for people and having solutions to, different medical and sometimes, psychological problems, then come and do medicine. It's a very wide and wide scope, and you can be here, you can be anything you want to be. You can do medicine and go and do get into IT and do, system, records. And for example, what we use for the whole equity affairs, that's a health, records thing with a background in health. You can do business. How, for example, this ETF or any other hospital out there is can be managed in a business kind of thing. You can do pediatrics if you love children like I do. You can do gynecology, obstetrics. You can fix bones and be an orthopedic. So it's so wide that you can, it's a world in another world. You can do anything once you have done medicine, and every day is a challenge. You meet new challenges every day, and the fact that you have all the years that you spent to get to where you are have equipped you with, the tools necessary to deal with those challenges, then it's a very fulfilling profession.
Yeah.
I'm fulfilled.
That's all for today.
Yes.
Asante sana, thank you for watching. If you have any question, you can always reach out to Dr.
Kanyua, yes. Yes, this number. Yeah.
We will put it on the screen. You can always reach out to them, and they are located at America. It's America on the road, on the highway. It's America on the town center, and you find them there. But if you have any question, you can always, of course, inbox us on our Facebook, YouTube pages. That is Oasis of Love, your last companion, and you will get the direction where they are. And I'm sure there's some commissions for cuts when you visit in our consultation.
Yes.
All right. That's all for today. Thank you so much. I am your host, Caroline Chiromani, and it's always an exciting episode each time. Bye.